So I agree, Jasmine. Sophia looks pretty bad today. I think the best course of action would be to go ahead and admit her into Children's. I know it's going to be a hardship for the family and just extra costs, but
Yeah.
it really is the safest place for her. Are you okay with that plan?
Yeah, definitely. Thanks again for coming and taking a look at her. In the future, if I have a question about a kiddo, how would you like me to approach you? I felt like I really wanted your input, but it was kind of difficult to get your cooperation.
Sure. I'm sorry that frustrated you, but really, Jasmine, you have great clinical sound judgment, and I just felt like you could handle it.
Well, I appreciate that you trust my clinical judgment, but I really still rely on and value your judgment as well and your input. And so I'll try and be more straightforward in the future.
Right. And I'm always here to help. In fact, do you want me to go ahead and call Children's right now and start the direct admit?
That would be great. I'll go ahead and talk to Sophia and her mom and let them know what the plan is, and I'll get started on the paperwork on my end.
Okay.
That'd be great.
That'd be good.
Thanks.
She needs some help today.
Yeah. Thanks
right.
so much.
You're welcome.
Oh, hi, Kylie. How are you today?
Hi, good. How are you doing?
I am good. It sounds like Mr. Rogers is on track for going to the skilled nursing facility today. Is that correct?
He is, yes. Everything's on track for that.
Oh, that's awesome to hear. I just wondered if you might have a moment to talk about our interaction yesterday. I really value your input and it helps me make better decisions, and I felt like it wasn't the most productive interaction yesterday.
Yeah, I agree. You know, it wasn't the most productive, and I apologize. I was very overwhelmed with everything that was going on and a few different order sets that I had as well.
Yeah, and I was really stressed on getting the information for the case manager and also getting myself organized for burn round, so I know that I might have been a little short.
And you know, next time I'll really try to focus on the patient's needs at hand and make so we can work together as a team so that we each have the information we need for a discharge plan.
That sounds great, and I'll also make sure it's clearer why I need the information in such a tight time frame.
Okay,
So
that
thanks so
sounds
much.
good. Yes, thank you.
Have a good day.
You too.
Wow, what a rush.
Gosh dang, man, we were so busy. I can't believe it. I'm just overwhelmed.
Yeah, I mean, what was the deal with that Ampho?
Oh gosh, I feel kind of bad about that one. That was when that came at the crux of just the entire crush, you know. And when the nurse called down, I really wasn't very kind to her. And now that I'm thinking back on it, I'm kind of wondering maybe I should give her a call or something and just apologize because, you know,
Yeah.
I was actually kind of short.
Kind of let her know we were pretty busy and kind of, let her know what was going on.
Yeah, because I mean, you know, otherwise she's never going to call down here again or
Yeah.
even really avoid us, and can't have that happening. I'll give her a call and apologize and just kind of tell her the situation. All
Sounds
right.
good.
Dr. Colbran, thank you for holding. Dr. Evans said to do what you think is best for the patient.
No, I really need to speak with Dr. Evans, as the success of this treatment and the welfare of our patient is really dependent on getting this clarification. If Mr. Forbes is not cardiac stable, and I honestly can't tell because I don't know the diagnoses and the medications, extracting this tooth in my office could place Mr. Forbes at significant risk.
Oh, I understand. Let me explain that to Dr. Evans. Dr. Evans! Dr. Evans! I believe you should speak with Dr. Colbran. She's Mr. Ralph Forbes' dentist. I understand a bit better that his medical condition could really be an issue with the dental procedure she wants to perform. Evidently, Mr. Forbes is not so sure about what his health history is or what medications he's on. I've pulled up his medical record here for you to review. She's waiting on the phone. Can you speak with her?
Hello, Dr. Colbran. This is Dr. Evans. Sorry for having you hold on so long. So, Mr. Forbes has a toothache?
Yes, he's been in pain for quite some time here.
Hey, I wanted to chat with you about the other day. Do you have a few minutes?
Sure.
Okay, that's fine. Yeah, let's go somewhere private. So, I was really upset when I came into the room the other day and I realized you had done the sign-in without me being present, and I'm wondering if you can tell me a little bit more about that.
Yeah, you know, so I got off the phone with you and the kiddo was really upset and the mom was getting anxious, and then, you know, the nurse came in early, and even though I knew you were still working on that MRI, I decided, you know, that I could go ahead and get things started. So I started the infusion, and other attendings that I've worked with don't require their presence for the sign-in, so I didn't know that was an issue.
Yeah, you know, I know it must be challenging to work with so many different attendings, and we all have different practices. But I really need to be present for the sign-in, and I really need to be part of the plan and the process for administering the medications. I know that it can be stressful when you have a crying kiddo and you have an anxious mom, and I know that those things can sort of make you feel like you need to move things along. And if you do, I want you to know that you can always call me. And if I'm busy, I can try to find another solution, maybe find another attending to come in or something like that. But communication is really important in order for us to have a good working relationship.
Okay. Yeah, and I agree with that, and I'm sorry for how it turned out, but I felt that you embarrassed me in front of the family, and I was really upset by that.
Well, and I think that I was sort of caught off guard with the sign-in, but then when I noticed that you had started giving medication without us even having a discussion about it, I was very angry. And at that point, I probably should have just taken a deep breath and stepped back. But I didn't, and I think it was a good learning experience for me as well.
Yes, and I should have spoken up before I started that infusion. I was frazzled by the situation, so I definitely will learn from that as well. So sorry for how that worked out.
Me too. I think that things will hopefully go better in the future when we're working together.
I think so too.
Okay.
Thanks.
All right, sounds good.